We're talking about
body contouring.
I don't think of body contouring necessarily as correlated with weight.
Is this gonna last forever? Is this permanent?
Reshape the body, give it that hourglass look that is in vogue right now.
But nothing, and I mean nothing, replaces the gold standard of good old-fashioned liposuction.
I would throat chop the next person I heard say lunchtime lipo.
Ladies and gentlemen, welcome your hosts of Skinterviews, the expert series, George Scandalis and Nathan Strom.
Come on!
Welcome to Skinterviews, the expert series. I'm one of your two hosts. My name is George Scandalis.
And I am Nathan Strom. Hello, everybody.
Hello. Hey to you too. Thank you.
Thank you so much. It's so good. Another sold out crowd. Wow.
Amazing. If you want to be part of our live studio audience, of course, all you got to do is go to our website, skinterviews.world, because we're taking over, and apply to buy tickets to be right in our studio audience with the rest of the people here today. Look, I got Ellie here today.
Oh, isn't he?
They wouldn't let my dog in the studio. How bad is that? How bad is that? It's actually nice to have a live audience again, especially with everything going on in the world with COVID. Everybody is socially distanced apart. Everybody's wearing their mask. Everybody's careful. We're the only ones not wearing a mask.
Well, we're a little bit lucky, aren't we?
Today, we're talking about
body contouring.
And this is something I definitely want. Did you know, Nathan, that when we think of body contouring, most people think about weight loss? And we got to talk about how big that industry is. In fact, in 2018, it was estimated that the weight loss industry alone, not body contouring, but the weight loss industry alone, has a value of $193 billion. Yes. And get this, by 2027, it's going to grow to almost $300 billion as an industry. That is absolutely huge.
So I've got some questions for you.
Well, you're going to ask me about another stat? Because you know I like my stats.
No. I've got some questions. So are we talking, are the options cold, heat, surgical, non-surgical? What are we doing?
We're talking about everything, but we got to think about, when we think about body contouring, we naturally gravitate to think of plastic surgery. So we think about things like liposuction or breast augmentation or even tummy tucks. We've, of course, talked about butt lifts in episode 2, which are a hot topic still today. But out of the top 5 surgeries performed in 2018 by our plastic surgeons, 3 of them were body contouring surgeries. And it was breast augmentation, tummy tucks, and liposuction.
That's crazy.
And that's just growing, absolutely growing. And if we remember from episode 2, how much butt lifts have grown in the last few years, butt lifts have grown. Got that? I know, total dad joke. But we are going to be looking at what else can we do. Is surgery the only option to get the perfect body? And where does it start? Does it start with the way we eat? Whether we exercise, how much we sleep? Are there ways to get that body without going under the knife? So our dermatologists and our plastic surgeons, our experts, they're mine, I love them.
Hey, can we hear from the experts now?
No, wait, I just want a little more time on camera.
I want to hear from the experts, George.
Listen, Nathan, I lost so much weight to be on front of the camera, and I didn't go under the knife, so I just want a few more seconds to show it.
The viewers want to hear from our experts, George.
Fine, let's go to the experts. I hate you.
I don't think of body contouring necessarily as correlated with weight.
Women often complain of things like cellulite, so in a later episode, we'll cover that as well. For this episode, we're focusing on body contouring, which is often curves, but a lot of my patients need contouring not just to lose weight. Some actually need to gain a few pounds as well. So contouring isn't always to be thinner. It's really to have proportion. And we're starting to understand that proportions don't always mean skinny. They just mean balanced.
Body contouring does not necessarily mean fat removal like it used to mean. It actually means sort of moving fat around. So we want to take it away from the waist. We want to add it to the buttocks and the hips. We want to get that hourglass figure.
So body contouring is just that. It's contouring the shape of your individual frame such that it gives you the shape that you desire or get you close to the shape that you desire, because we can't always get there.
Give it that hourglass look that is in vogue right now.
The fundamentals of body contouring is typically, for most people, how they look when they're dressed.
There are patients who, for example, they can't find certain clothing to fit them well because of whatever zone that may be. So whether that's their midsection, their outer thigh, their inner thigh is rubbing, they're getting chafing in that area. They're very bothered by, let's say, a love handle that might hang over top of a pant, no matter, again, what size they go. So they go too big, it doesn't fit, it falls down. They go too small, they have a love handle.
So you can do all kinds of things. For example, this morning I took 2 of the silicone implants. I taped one in this arm, I taped one in this arm, and I put 2 in the butt. I find that just gives the illusion of a nice contoured body. Now, the 3M sticky tape is hard on the skin, but it works. There's no downtime, no involvement. That's it. It works. See? So to get really to the truth of body contouring, it's just that. Listen, everyone, the whole world, we all do stuff. We watch our diets, we work out, we do stuff. It's to have that contour, that frame, such that if you're getting in the shower, walk naked in front of the mirror, you're happy with your contour.
I think body contouring is not just for people who are already fit or who are not willing to make lifestyle changes. That isn't important, but it is separate from, let's say, changing a certain contour on a part of the body.
Everyone nowadays, females, are wearing these tight-fitted, the tight spandex type dresses, tights, whatever. So contour is very, very important, and it ties into everything else. We talked earlier about BBLs and shaping that big booty, right? I mean, there's a whole music industry based on booty, right? It's everywhere. Bosom, booty, shoulder. And then we can get into the face, the contour of the face. So it's really everywhere. I mean, the fundamentals of everything we're doing in terms of surgery has to do with contour.
I did it in my training, but I don't perform that in my practice anymore just because, again, I specialize in the face. And like I told everyone before, you can't be good at everything. There's only 24 hours in a day and 7 days in a week. So I specialize really in the face. That's where my passion lies. But I know enough about body contouring to know that it's truly an art. It's like sculpting. It's like sculpting, which is, by the way, something I used to do. I actually majored in art, so sculpting was one of my passions, is to create, for example, a face or a head out of a block of something, okay? And you have to carve it. You have to play with shadows, light reflections, and in essence, contours. So you have to know what you're looking for. And you have to know how to get from point A to point B, not only with an aesthetic goal in mind, but also safely. That's where the medicine comes into play. So it's truly an art to contour the body. And it's one of the most challenging aspects of aesthetic medicine.
Everything in beauty, like we've talked about before, is all about contours, highlights and shadows.
So the options for surgical versus non-surgical are many. It's a very popular, very desirable thing to reshape the body.
So body contouring for me, I mean, in my experience, George, really it's limited. When it comes down to surgical, non-surgical, even that is difficult. For example, there's a great product we use out there that is a deoxycholic acid, which will help melt fat in certain areas and was originally approved for the submental region for people that get that thick turkey neck kind of thing. So this is what's described as a non-surgical treatment. It's basically a needle, it melts the fat gets absorbed, it goes away. I don't like to break it into surgery or not because you still had a procedure. No, I didn't take a shining 15 blade and jab it in your neck, but you still had a procedure. There's still downtime, there's still risks, there's still benefits. So I look at it as that a procedure, a treatment is a treatment. And so when it comes to body contouring, whether that's contouring your cheeks with a filler of some type, or that's using a liposculptor to shape your flanks, all of them are body contouring. Now, some fall in the surgical realm, and some fall in the described non-surgical realm. I'm not sure that the division is so clear, but I think using them all together, combining different tools from the toolbox, that's how you get the ultimate result. And if all else fails, again, George, like I said, you can always go to the, silicone tape on things, and everywhere you can do whatever you need. Whatever works for you.
Body contouring is such a huge and diverse field, so I'm going to stick to the surgical stuff, and I'm going to let my derm colleagues talk about the non-surgical stuff.
So since I don't do surgery, I'll talk about the non-surgical options, and there's quite a few treatments available for body sculpting nowadays.
I would say the most commonly, thought of approach to body contouring would be fat reduction.
In fact, the demand for fat reduction procedures has grown dramatically. International research company Global Data predicts non-invasive and minimally invasive fat reduction procedures to be a $1.1 billion industry by 2022.
In terms of reducing fatty tissue, of course, the non-surgical options that we offer would be cryolipolysis, otherwise known as Coolsculpting.
It's been more than a decade since it was approved for use, and in that time, it has become an increasingly popular procedure with over 8 million treatments performed. And it is really good for patients looking to reduce those stubborn pockets of fat.
So it does sculpt the body. It will change the shape of the body in a long-term way that doesn't necessarily impact whether you lose or gain weight.
We're getting really good at Coolsculpting, no downtime, no surgery, and basically there's different hand pieces that fit different areas of the body, and we can recontour the body, arms, abs, inner thighs, even the chin.
The name, Coolsculpting really does speak to what it does.
The scientific principle is called cryolipolysis, and that's when fat cells are frozen during the procedure. So they actually die off and leave the body through a natural process.
Or deoxycholic acid, which in Canada is known as Valkyra, and in the US is known as Kybella.
I have no idea why or who comes up with these crazy names for drugs. I mean, they seem to get crazier and crazier as the times go on. I don't know why they're different, but they are.
Kybella is approved for the submental chin, so just right under the chin for that area.
And our practice was actually involved in the clinical trials of this product, and we've published on our experience treating the double chin, the jowls.
It's actually really interesting, when people will ask me about it. Again, I like analogy, so it's like soap breaks up detergent on your pan. I mean, that's what you're doing. You're basically putting a detergent-like product right where some people have a little fat deposit. Again, it has often nothing to do with weight, it's just anatomy and genetics, and it breaks down the fat. You have to make sure I've seen people where it's not been injected in a sort of a pattern, and they can have lumps and bumps or divots, so it's important that you have a good injector.
A bit of the science behind it. So deoxycholic acid is a naturally occurring molecule in the body, and it helps with the breakdown of fat. And when injected, it actually causes the permanent destruction of fat cells so that those cells can no longer store fat. And because it destroys fat cells once the desired aesthetic appearance is achieved, it's not expected that you'll need retreatment. However, that initial treatment regimen can be tailored based on the size of the pocket of fat, the desired contouring, but it can require several treatments to achieve that optimal outcome. You can, though, see results even after one treatment, but it really depends on the size of the pocket of fat, what you're trying to achieve.
But it also can be used for the submandibular chin to define the jawline. Also, very popular is bra fat injections. People don't like that little tablespoon of bra fat that's just when they wear a tank top they can see. And also the bigger area of back bra fat. So we can inject those areas. Also, people that get C-sections, they'll have a scar, and then just underneath it there'll be a ridge of fat. It's because of the way the incision was stitched. And so it's a very simple injectable procedure with no downtime that we inject that, and it can disappear over time.
No, I don't use Kybella in other areas other than the submental fat because I think you've got to really know what you're doing, and there's nerves because you're injecting it deep. So no, I don't use it in any other area.
You can use Kybella in the flanks, I find that Coolsculpting is better for larger areas, but if it's a small area, in our practice, one that won't fit the attachment of the Coolsculpting attachment, then we can definitely do that with Kybella. One popular area is the area right under the breast. There tends to be 2 little patches of volume of fat, even when someone is fit and thin, and those areas do really well with Kybella.
In terms of other body contouring types of treatments, certainly we do sometimes use, again, more technology-based modalities to still contour the body from a skin perspective. So what we do is we use technologies to help tighten skin, to raise up the skin, to lift the skin in various locations on the body. And so those are done with, again, different types of modalities ranging from, let's say, micro-focused ultrasound.
Several years ago, I got a ultra-shape laser, it's actually an ultrasound, which decreases, it's an ultrasound beam that goes down into the fat layer through a computerized head and warms up the fat and basically breaks it down. It's been very useful for, I've had 3 children. A lot of women have a little bit of a fat deposit on the tummy where no matter how much they exercise, they can't get rid of it. A little bit on the hips. Sometimes women have a bit of extra there genetically. So we've used that over the years in my clinic for that and with very good results.
You can use ultrasound or radio frequency based technologies that can help to promote collagen. You can also help tighten the skin.
So we put something on the skin to help the laser head move more freely and decrease the heat. It feels hot, and people say it's a bit uncomfortable from the heat. So pain's very relative. Some people, they're not bothered by it at all, and some people find it very uncomfortable. So we have laughing gas and painkillers before the procedure if they need it.
And also, we do fillers.
I mean, if you can do a Brazilian butt lift with filler, you can certainly do other body contouring with injectables as well.
So injectable fillers like Sculptra, Voluma, or Renuva, a new injectable that induces your own body's fat, that we inject into the buttocks or the hip dip to augment those areas. And we're even using Renuva in breasts. Some people have uneven breast size, and we can even that out with Renuva. Or we can just increase breast size with Renuva without having to do a surgical fat removal elsewhere on the body.
In my office, we offer M-Sculpt, which I love because it does muscle toning as well as fat melting.
To help narrow the waist, cinch the waist by extreme muscle contractions. And also it helps raise the buttocks by lifting and toning the muscles.
Which I don't think the surgical options can really address.
So electromuscle stimulation includes non-invasive HIFEM, and that stands for high intensity focused electromagnetic technology. There's other ones, so there's active magnetic pulse technology, and they're the newest technologies for body contouring. So HIFEM, for example, uses this high intensity energy to trigger what's called supramaximal contractions. And this is the kind that can't be achieved just by voluntary muscle action. It's approved by the FDA for improving abdominal tone, strengthening the abdominal muscles, developing a firmer abdomen, and strengthening, toning, and firming the buttocks.
And also Fotona, which can help tighten and contour just a bit, and it works really well after surgical approaches or for people who are really just not good candidates or who absolutely under no circumstances want to have surgery.
On the body, I think fat reduction non-surgically is comparable to a surgical result with enough treatment sessions.
Knowing what I know about non-invasive treatments, I would always opt for the non-invasive over the invasive treatment unless I'm just not able to get the result that I want. And I'm, at that point where I really need to or want to do something more aggressive. In my world, I have access to all of these treatments, and I feel that you can achieve a lot of really nice results with a very little risk.
Especially in an area like the submentum, for example, I do think we could certainly achieve very close to, if not better, non-surgical results than a surgical result, just given the risks of surgery, the propensity for, let's say, scars in certain areas of the body as a result of surgery, which often, we don't really leave any mark whatsoever.
There's lots of options for non-surgical approaches to body contouring. Unfortunately, I think most of them are mediocre, and most people should really go right to surgical.
I think for non-surgical options, first of all, for somebody who really doesn't want to undergo something more invasive. That's the most common reason I think people look at some of these alternative treatments. I do think that if non-surgical options are better for somebody who has a smaller pocket of fat that they're trying to target, for example, if there's a lot of laxity or changes that a patient is hoping or expecting to achieve from treatment, then they may want to look to what options there are surgically for that particular area.
When I'm considering a patient for non-surgical contouring, I always ask them first, would you have surgery? And if they would, I send them off to the plastic surgeon or dermatologist who does those procedures. But otherwise, it's really for that person who just needs a very little bit, either after surgery or somebody who absolutely under no circumstances wants surgery. It's just out of the question. So that means that almost anything else we do, as long as it offers some reliable results, is going to make them happy enough. And I'm very realistic about what we can get. So, we look at each patient, we tell them what we can get, and sometimes, even if they don't want surgery, I tell them it's not worth it to do the non-surgical option because it won't give them enough of a result to be worth the money they spend.
Certain zones, I think without question, we can achieve a surgical result, but there are certainly things that people ask for that are just not surgically possible. So surgeries have their role. There's no question about that. Especially when it comes to skin laxity. I think skin laxity, there's a certain amount of modification that can be made non-surgically, and really there's no comparison to surgery from that perspective when there's enough skin laxity that needs to be corrected.
So let's say you come to me and you've got some skin lax in your tummy and you've got a little bit extra fat and you're like, hey, I'll just get some liposuction. But guess what? Just like Zach Morris after Saved by the Bell, it just doesn't work. If you do liposuction with somebody who's got skin laxity, you're actually going to make it worse because you're deflating that lax skin. In those situations, you probably need a tummy tuck to remove all the extra skin and the fat at the same time.
Skin laxity is an issue when we do either Kybella or liposuction, and that's where garments are worn, pressure garments, in order to help the skin heal back down. It is not as much of an issue with Coolsculpting, which I think is now being studied, because it's interesting that fat can be reduced, and yet there doesn't seem to be a lot of skin laxity. So I think Coolsculpting now is being studied for skin tightening.
I know a lot of people talk about non-surgical skin tightening and fat reduction. And the one thing I have to say is no device, no matter how charismatic the salesperson, is going to remove that extra skin. It's just not going to cut it.
Surgery, I think, obviously can make a faster, larger difference in someone who has a lot more to change in terms of their contour.
So how can we deal with fat? We can suck the fat, we can freeze the fat, we can burn the fat, we can dissolve the fat. But nothing, and I mean nothing, replaces the gold standard of good old-fashioned liposuction.
So liposuction, I will be quite honest with you. I started practicing plastic surgery back in 2006. And when I started as a young plastic surgeon, though this is about aging, so I'm still young, I absolutely despised liposuction. I didn't like it. I'll tell you why. I came out of a training program where I was a surgeon. I was a cutter, right? I cut things, I moved things, I sewed things. That's what I did. That's what I was trained to do. So liposuction to me was kind of like oh my God, Nora, this liposuction. But what I learned over the years is that the patients were happy. I was getting tremendous results. So as I did more of the basic liposuction, I then started to branch out a little more and did, the typical liposuction, liposuction your belly, liposuction your flanks. What I learned over time is that it truly is more of an art than I had myself appreciated. Right? It really was. I could take now, and I started doing different liposuction techniques, different areas. I started taking fat from one area, putting it into another. And it took it from almost like painting a wall, mundane procedure for a surgeon, and turned it into kind of a cool artistic activity. And it was really, really good. So I actually like liposuction now. If I compare it to my own practice. Nothing changed so much with the patients. It changed in me, and then I started to learn and see what I could achieve and how powerful a tool it was.
So who's an ideal candidate for liposuction? I mean, liposuction is for stubborn areas. This is not a technique for massive weight loss. So if you've got a lot of pounds packed on, liposuction is not the answer, my friend.
So when we're talking about body contouring procedures, if we're getting into the bigger procedures that have real powerful effects, first of all, fantastic procedures. These are falling in the realms of things like tummy tucks.
So what is a tummy tuck? A tummy tuck is an operation to remove the extra skin in the lower abdomen, tighten the muscles, and flatten the tummy. But before we can talk about a tummy tuck, we have to understand what happens in pregnancy. When a pregnant uterus is expanding, it's pushing out on those muscles, the rectus abdominis muscles, that's the six-pack muscle. It splays them apart. After the baby's born, those muscles never fully go back, and that leads to that diastasis. And that's the kind of thing that patients tell me that after having 2 glasses of water, they feel like they look 6 months pregnant. There's no way in the gym to reverse those changes. You can do as many crunches as you want, strengthen the muscle this way, but it's never gonna bring them back together. The only way to do that is surgically with a tummy tuck.
I think after having 4 children, I think body contouring, yes, thank you, is an important way sometimes to get back that that form and that figure that is not always perfectly achievable after children, but certainly you can get pretty close. So I do think both non-surgical and surgical body contouring can play a role, not only in that scenario, but in many other scenarios. And without question, I would consider it.
I love doing a tummy tuck. A patient comes to me after they've had multiple children, they've got an abdomen that's sticking out when they eat a little bit of food, they've got stretch marks, loose skin, and they just don't feel themselves. Having children, it's not a reason that you have to lose your body. And I love being able to make that transformation to patients and get them back to where they once were.
Powerful surgeries, powerful procedures with very powerful results. Let's not forget though, big, powerful surgeries, although powerful results, come with potential, though a bit small, recovery periods, complications, and risks.
Yeah, in terms of downtime, certainly in my practice, we do cryolipolysis as well as the injectable deoxycholic acid. And with those, you potentially can have some swelling and bruising. The injectable in the area of the double chin, I think certainly people need to be prepared that they might look a little bullfrogish, a little bit swollen, depending on the amount of fat in the area and the volume of treatment, particularly as it relates to injectable deoxycholic acid. But as far as the other electromuscle stimulations, we don't actually have that in our practice. So I would defer to one of my colleagues who does that.
The real downtime associated with non-surgical versus surgical is a big difference. The people that get injectables done, they're out and about, Emsculpt, Coolsculpt, they're out and about living their life and feeling free. And if you do a surgical treatment, you have to do the corset training for the waist. You have to not sit on your butt for a number of weeks. There's some bruising, a lot of bruising, tenderness. And so the downtime with fat transfer and BBLs is a lot higher on the surgical side than it is on the non-surgical side.
George, I swear to God, I would throat chop the next person I heard say lunchtime lipo. I have had so many people. Hi, Dr. Howley, yes. I was interested in your lunchtime facelift. I used to go on this rant about this whole thing is just marketing, right? To get people in your clinic. Oh, I'm getting my facelift done at lunchtime. Oh, lunchtime facelift. I'm gonna have a facelift and I have a meeting at 3. I'm meeting Kelsey for yoga at 4. Stop. The only thing that's true about a lunchtime facelift, it actually does exist. I do them. I start them all at 12 p.m. That is the only. Now, whether it's liposuction or facelifts, yes, I do it. I do lunchtime lipo. We have you scheduled from 12 to 1:30, lunchtime. That's it.
Well, the great thing is that the non-surgical options tend to have no downtime. So Emsculpt, you feel a little sore after, but that feels so good. And then you notice that your workout goes even better and you have more core strength than you thought you had, and you can push your workout a little bit harder. And the Fetona tightening, that just hurts in the moment, but afterwards there's really no downtime with it at all.
Liposuction is probably, throughout North America, one of the most common procedures that is registered in terms of cosmetic procedures, right? Your big ones, breast implants, facelifts, liposuction, those are the big ones. So when it comes to liposuction, we have to, in my mind, there's a lot out there. right? There's a lot out there on how we do liposuction or devices available to do liposuction. And that can be laser, radio frequency, traditional, whatever. I always think of it like this. I look at the patient and I think liposuction has been around since the days of plastic surgery. It's simply, if we dumb it down and keep it simple, we are removing fat from underneath your skin for a certain area. We're doing it in such a way that we're moving it in places that's giving us the contour we want. Now, new technology has come along to help us get better results more efficiently. I think the first one kind of was, you remember the old, when I was a resident, liposuction was this. It was a wand with a suction at the tip, and you put it in after tumescing or putting some freezing and epinephrine in the tissue, and you physically broke up the fat with this thing and sucked it out into a bucket. Then came along, and what I use now, which I love, is a power-assisted liposuction. So this device basically takes that handle. Instead of me being the force of driving it, it vibrates back and forth. So it breaks down the tissue, breaks down the fat, less traumatic, better result. We can get into other ones, which is now using more internal technology to disrupt the fat cells before we extract them, before we liposuct them. Now that could be using a radio, I'm not going to name names or brands or whatever, but whether that's using a laser that goes in under the skin, melts the fat, breaks down the fat, or we're using a radio frequency, which is doing the same thing to disrupt those fat cells and break those cells down. In each event, no matter what that modality is, in most, if not all of them, as soon as you're finished with that modality, what do? Stick in the liposuction curette and suck out the fat. So we got to be very careful when I look at some of the results and before and afters of, let's say, a new technology for liposuction using, we'll call it laser, we'll call it heat, we'll call it what have you. If you look at the before and after picture, I would love to see that picture if you just did traditional liposuction. What if we didn't use the technology? What if we just did traditional liposuction on patient A, looked at the before and after? Would I actually see a difference? In many cases, I'm not sure. I mean, there's no question that someone who's had multiple liposuction procedures in an area, or we'll say a male with gynecomastia where there's more of that thick, fibrous tissue, some of those modalities, like a laser or heat, which helps break down that fiber structure, can be beneficial, whether it's scar from previous liposuction or just fibrous tissue. But that being said, we have to be very careful about how we select it, because every time you introduce a new modality, whether it's heat or it's light or it's laser, could be more complication.
In my 20 years of practice, I've seen plenty of times where surgery has gone wrong, where either the scars are in the wrong place, they're super high so they're visible, and now someone likes their body but they can't wear a bikini because they hate the scar, or the belly button is disfigured or erased and they hate that look, or their stomach looks too flat like a washboard. When you look at a virgin stomach that hasn't had surgery, or even children for that matter, it does have curves and contours that are very sexy and beautiful. So a good surgeon knows how to contour, how to preserve the belly button, and how to minimize those scars. On the good side, there's a lot I can do with lasers to help erase scars, or at least minimize them, and that can have a very big impact.
The more invasive, the longer, the bigger the procedure surgically, these are the surgeries that potentially have the highest complications or setbacks.
Surgery's not without risk. Nothing is. But the most important thing is you have to trust your surgeon. Trust that they're going to be safe, do the right things, and if something happens, they're going to take care of you.
I had a patient who had a, what we're going to call a little scar revision. She had a C-section scar, so we kind of take that scar out, pull the skin a little tight. Very minor procedure, we would call it. Well, and this is a young, fit lady. Well, she developed a seroma, a collection of fluid underneath her skin flap. Well, her recovery really should have been a couple of weeks. Dissolving stitch, you take the tape off, you're all good, you're back to yoga, kickboxing, whatever you're doing. But she developed a seroma, which in itself is not a major issue or complication, but it is for her. Because now she couldn't go back to squash, she couldn't go back to training, she couldn't go back to whatever. We had to drain this several times. Again, back in the office, wearing compression garments. So it went from a 1 to 2 week quick recovery to now a 4 to 6 week recovery. So although the complication in itself is not a disaster, It sure was for her and lifestyle. And this is just minor. So we have to keep those things in mind. And this is where, when it comes to body contouring, you need to have a very, very clear discussion and a great relationship with your patients, such that if something like that happens, they need to know that A, you'll be there medically, professionally, and B, I always tell them, I've got your back, and acknowledge with them, you know what? This really sucks. This sucks, but guess what? We're gonna get it fixed. And they need that hand-holding. They need it. I would need it. If I was expecting to have something done in 2 weeks and found out that, it's now gonna be 8, or I was scheduled for a 2-week vacation and you told me a day in, oh, by the way, it's only 2 days, it's disappointing. I had expectations. So we have to manage them clinically and professionally, but we have to understand these are big, big deal if a complication occurs.
When I see patients that have had surgeries that have gone too far, or injections that have gone too far, it really upsets me because it's a reflection also on my profession. Because you know what I say to patients a lot when they haven't done anything and they're like, I don't want to look like X or this person or that person. I'll say, for every person that looks a little off, there's thousands of people, millions that look great that you don't even know they've had anything done because it's been done well. There's bad lawyers, there's bad dentists, there's bad accountants, there's some surgeons, bad is maybe the wrong word, there's some that are better than others. And so choose your provider wisely.
I always tell patients, you gotta have faith in the doctor you choose and you have to trust them. And guess what? That might not be me, and that's okay, because you have to feel comfortable with who it is that you decide to have surgery with, so you know that they're gonna get you to where you wanna be, and if there's any problems, they're gonna be there for you.
Patient expectations. Wow, that can be probably, forget technical surgery. Managing and setting patient expectations, probably the most difficult thing for a surgeon and his staff in his office or her office to do.
I think expectation setting, reviewing with the patient, their goals, you really want to be aligned with your patient, know what they're hoping to achieve, and then discussing what treatment options may be available to them to help achieve that result. Because the last thing you want is someone going in expecting like this amazing, wow, surgical result, and you're giving them not that outcome. And I do explain, especially for some of these treatments, if they're non-surgical, say you're relying on stimulating collagen or you're doing cryolipolysis, I often say, it's hard to predict. On average, you may see, this % improvement, but it is a bit of a bell curve. Some people are amazing responders. They're great fat buster uppers. They see huge improvement and they're happy, but there's other people who may not achieve that same outcome. And so going into it, I just want them to be prepared for what the possible outcomes may be and the degree of improvement they may see from the treatments that I have available to them.
My first question to myself is, so once I figure out, of course, what the patient is in for, what is their goal, what have they come in, let's say, presenting with and wanting to achieve? Can I achieve that for them? So that's really what I ask myself is, can I achieve this for them? Are they going to be happy with what I'm going to be able to provide as an ultimate result? And if the answer is that I have the modalities to satisfy what it is they're trying to achieve, and we determine that based on many different modalities. So if there's any uncertainty, we sort of go down different paths of before and afters and things like that, asking them if they would consider surgery. Because someone who's a surgical candidate looking for a surgical result, without question, they should talk to a surgeon. So that's a given, those are easy. The patients who are surgical candidates who do not want surgery are really tricky because there are times I have to say that I cannot achieve the result that they're looking for and I cannot make them happy, and that they should speak to a surgeon because maybe there are less aggressive surgical options, or they're just not educated around what the surgery risks entail, and providing that education would really, again, solve the issue. When I do feel that I can achieve something non-surgically and there's a surgical option, I still like them to have both opinions. So I will often encourage them to get a surgical opinion as well. And that's because it could go either way and they're gonna have different probably results based on their choice. The last scenario would be if the surgical option and the non-surgical option can produce very similar results, I mean, there's no question. I will certainly present my approach. I will present surgery as an option, but I will tell them that I do believe I can meet their expectations with a non-surgical approach.
It's always unpredictable to guarantee any results. Guaranteeing results means that we have a crystal ball where we can tell what exactly the patient expects, which, by the way, is a moving target because patients a lot of times don't know what to expect. So you're basically trying to aim and always hit a moving target, bullseye every single time. That just doesn't exist. So to answer that question, you need a crystal ball. But managing expectations is the more important aspect. And one way is to do that through before and after pictures, a lot of other means of communication to make sure that the patient understands what are the limitations, what can be done, and what is the practitioner's experience. We all have different experience and things work differently in different people's hands based on our experience, our artistic ability. And so you combine these two, that will ultimately set your limit as a surgeon. And it's important to communicate that with the patient. And that way the patient has realistic expectations.
I mean, if you watch some of these great programs, especially I'll say in America, where these patients are undergoing these massive transformations in one surgical setting, I sit back and go, how could the surgeon do that in one day? I can't believe it. But behind the scenes, when the camera swings, you'll notice 5 other surgeons there, right? Like, it's not this one individual. But sometimes we don't see that as surgeons. So, and the patients don't see that. What they see is, patient X went in with, to say they lost all kinds of weight and they have loose skin, and they come out on the other side of the OR door, tight and fit as a fiddle. Well, what they didn't see was that there's a massive team involved here. And they didn't just walk out the door.
So sometimes I see patients who come in to see me after having surgery somewhere else and they're not happy with the result. I have a look and they look great. What does that tell me? That tells me that there's a disconnect between their expectations and what the surgeon was able to provide. And this all comes down to communication. I think it's so important for patients and their doctor to have open communication so that they can really understand what your expectations are and what we're able to provide for you surgically. I spend so much time talking about that and setting realistic goals and managing expectations.
You have to remember, that patient is coming through, they trust your team. They came through the door, they're seeking advice, they have some trust in you. My job is then to develop a trust in them. And that trust comes from this, taking the time to ask the patient, what is it that bothers you? Where would you like to be? And that path for everyone is very different. Some people will present with a problem, and it doesn't matter what it is. My breasts are too low down here. I want them up. Very doable. Other patients will present to you with a bump on their nose that you can't even see or feel, and then they'll show you a picture of a model with a very tiny little bunny nose that you will never, the best rhinoplasty surgeon in the world could never get you there. That is a patient that's going to take some time because you have to set expectations. In my experience, if you can set expectations and be honest with the patient, be honest with them, tell them there is no way you'll get here, you are on a much better path to having a successful result. Not for you, for them. They have to be realistic. And I have many patients that I've talked out of surgery. No, this surgery is not for you because your expectation of either the result or how the recovery is going to go or how your downtime is going to go in real time is not real. So I don't want to subject you to that because no matter what result I get on a photograph, you're going to be disappointed. And if you're disappointed, I'm disappointed. So we're not doing it.
Patients often ask me before body contouring surgery, do I have to lose weight? Well, if you're overweight, yeah, you do. Think about it. You want to be in the best shape possible for your surgery. And the way I like to think about it is like a snowman. Think about a snowman. When you make a snowman, do you want your final product to be something that you carve and then it melts down a little bit and that's your final product? Or do you want it to melt down and then you can carve the best snowman that you can? Right? It stands to reason that you want to be in the best shape you can so I can be as aggressive with my surgery as possible.
I would really have to look inside and say, okay, what can I do to better myself before I get there, or to better myself such that when I have my liposuction, I'm in the best position I can be to get a good result, nutrition-wise, weight-wise, activity-wise. That's how I would go about it. So you get this all the time. Is this going to last forever? Is this permanent?
I mean, that's a double-edged question. The fat cells that I remove, they're not coming back. They're gone. But that's not a license to go chow down on donuts and Big Macs. Because guess what? Those other fat cells that are there, they'd be more than happy to take it up and grow.
Even when it comes to permanence with the FDA, that stands for about 2 years. So when they talk about permanent laser hair removal, they say 2 years counts as permanent. So nothing is really permanent. I always tell my patients, you're stuck with me for life. So permanent is a while, and then we age, our bodies change, hormones change, and so you kind of have to maintain everything you do. So I don't really think of anything as permanent. My husband always jokes with me because I tell him life is temporary, so nothing is permanent.
I feel like people don't understand the concept that when you do liposuction or Coolsculpting or Kybella or anything that removes fat from one area, the fat does not migrate to other areas. That when you gain weight, your recontoured body still is capable of gaining weight. It just gains weight in a different distribution where more of the cells are intact. And so people often say, oh, if I do liposuction, is my fat going to migrate? It doesn't migrate. Your fat cells are storage cells, and they're expandable and contractible. A person who weighs 900 pounds has the same number of fat cells as a person who weighs 100 pounds. So if you focally take out fat cells from their abdomen, then over time, if they gain weight, 20, 30 pounds, they'll gain more weight on their arms and thighs and not as much in their waistline. If they hadn't done the lipo, they would have gained a lot of weight in their waistline, where those fat cells were intact. So what people start to feel is that their fat has shifted and moved to different parts of their body. But the truth is, if you stay the same weight, you will not gain more weight elsewhere. It will stay as it is.
If I take a patient and we, for example, do a tummy tuck, and he or she has this loose skin in their belly, and we pull and tighten that skin, and we take that skin, and it's gone. That skin is gone. Is gone. It's not coming back. You're not going to wake up in 6 months and go, damn, look, that skin came back. What a miracle. No. That being said, that patient will continue. Their body will transform. They will age. We just talked about that in previous episode. You will age. Your skin will get laxer. If you go and gain 80 pounds, your belly's going to gain weight. There's no question. But sometimes the things that we reverse or the things that we do with surgery, whether it's cutting out skin, removing excess fat from a certain area, once that fat is gone, once those fat cells are gone, they're gone. Can they be replenished by good or bad? Yes. So if I take a patient and look at the opposite, if I take a patient and I liposculpt them, I will say, for example, do their flanks, and we do a breast lift, and we do it all, and that patient, for some reason, within 6 months, loses 80 pounds for whatever reason, she's going to lose more fat. She's going to sag. Her skin's going to sag. If that same patient gains 80 pounds, they're going to fill out, right? And so the results are permanent in terms of the specific thing you removed, but your ultimate look, your ultimate contour certainly can change depending on the individual.
The ideal candidate for body contouring is anyone who wishes to reshape their body, wants to increase their confidence by having their clothes fit differently and feeling better about themselves. Now, the one caveat is people that want to change their body shape should also be investing in exercise and lifestyle changes. And so it can't just be surgery that fixes the body, quote unquote. It has to be your engagement in taking care of your body and being your best possible self. And then there are some things that genetically or because of your age, you can't change. And those are the things that you can modify with procedures.
I wouldn't have a Brazilian butt lift, but I would have liposuction. And when it comes to guys, where would I have it? Most guys come in for liposuction, it's their love handles, right? That's usually the guy. Or gynecomastia, fullness around their chest. Liposuction I would have, I'll tell you why. It has, there's no question, as I mentioned, it has a downtime. There's a downtime, there's a healing, there's a thing. But I think the expectations can be managed reasonably well. And I think if you take a middle-aged man like myself and you were to have liposuction of, say, a common area like your flanks, it's doable, right? It's doable. So I'm going to get a result. I can manage my life. I'm not checked out for 3 months or anything. I can manage my life and do it and get a result I want. So liposuction I would have, yeah.
Well, I mean, I'm in my 50s, and a lot of my friends, it's a time sometimes when you start looking at, corrective plastic surgery. I've had 3 children, tummy tucks. I know about some of my friends have had tummy tucks and breast lifts and things like that. So I'm very much about empowering oneself to feel good about themselves and doing whatever that takes and not apologizing for it. And I think I very much endorse plastic surgery if it's, something that you want to do and it makes you feel better about yourself.
We all want to feel good when we look in the mirror. So just like with the face, it's good to look at yourself with kind eyes and to see your best features, but it's also good to know that there's things that you can do to help soften those contours. And with hormones and weight gain, weight loss, having children, and honestly, I love my children, but they do suck the life out of me, and they definitely affect your body. So all of those things have an impact. And it's nice to have treatments that can help restore some of the contours to help you look in the mirror and kind of like what you see. But there is a level of acceptance as well. And people really don't realize how much the skin affects your body contours. And we're talking about curves on the body, that's one thing, but it's also the arms that have an impact and above the knees. So if we kind of take the conversation out a little bit further away from just the trunk to the other parts of the body, there's so much that we can do that we couldn't do in the past to help the skin be firmer, less crepey, more even in tone, and that can really contribute a lot to body positivity as well.
Well, I think with respect to body positivity, I think there's this. We're living in an age of everything's got filters, and there's like what's real and what's not. So it's hard for young people. But as a medical professional, again, it comes down to exercise, eating well, looking after yourself, and not trying to have quick fixes for things. And so I don't know what to say. I get frustrated sometimes when I see all the fakeness and all the filters and all the people trying to sell vitamins for weight loss, like celebrities. It's upsetting. And a lot of these young people are very, they're just desperate to be like so-and-so on social media. So it bothers me. And as a medical professional, I try to talk about the science with respect to that, which I think we're doing on this show.
In everything I do, diet and lifestyle plays a very key role.
Yeah, I mean, we were talking about body contouring. Of course, if you have 3 C-sections and you want to do something, no amount of exercise and diet is going to help that. Sometimes, depending. But, the best thing you can do is, again, eat healthy, sleep well, try to exercise 3 times a week, get your heart rate up. The studies show that it helps. And I do think that, again, going back to inflammation and diet, carbs are a big problem with respect to inflammation and weight gain. So I think healthy lifestyle and eating with respect to focusing on decreasing your carbs, I think is a good way to go.
So starting with diet, what you put in your body really does affect your metabolism and your overall health. So trying to cut out simple carbs, high glycemic index foods is really helpful. Having more water, and eating your water is good. So fruits and vegetables contain a lot of water, along with drinking water, and you can put all sorts of stuff into your water to make it more palatable and delicious. And then a lot of teas that are non-caffeinated also are a great way to get hydration in. So hydration is really important. And then having higher antioxidant foods. What's interesting about antioxidants is that when you think about a plant and the worst place to grow, you think about the desert where there's just sand and sun and this poor cactus is stuck there and doesn't have legs, can't leave. So it makes antioxidants, and it's really alchemy. It doesn't only survive, it actually thrives in that environment. It makes water, it makes these beautiful colored flowers. And those are all packed with antioxidants. So when we eat those foods that are growing in the harshest environments, we get the benefits of those antioxidants, and that helps our bodies rejuvenate and recover and do well, whether it's our face or our body skin and even fat metabolism. So diet is critical. And then there's exercise. When you exercise, you firm and you tone. And the worst thing is to be skinny fat. When somebody is really thin but they don't have good muscle tone, clothes just don't look as good on them. Their skin doesn't hang as well. So you could be the same weight, but somebody who is muscular will look more beautiful and actually have more energy. So diet and exercise are essential.
One of the most important things is a healthy lifestyle. Right? Patients who come to me and they say, I want to lose weight. And they say, I've got a goal, but a goal's not good enough. You need to have a path. Because a goal without a path is just a dream. You need to have a healthy diet. You need to exercise. You need to have a really good lifestyle.
Thank you for watching another episode of Skinterviews, the expert series. Today we learned all about body contouring, and you could be like me and book an appointment with one of our experts and get everything tucked, stapled, sucked, stitched, put back together, shaped the way you want. Or you could be like Nathan and get all these steps in and do the bike riding and the exercising and all the non-fun stuff. I'm gonna go have a Big Mac and then go seek out the advice of my surgeon. What are you gonna do?
See you next time on Skinterviews. Don't forget to follow us, skin.terviews on Instagram, Facebook, and LinkedIn. And don't forget to check out our website, skinterviews.world.
And like we said, if you want to be part of our live studio audience for one of our other episodes, all you got to do is go skinterviews.world, click buy tickets, and be part of the audience today. Thank you so much for watching, everyone. We'll see you on our next episode, and I promise it's going to be quite expertly. I'm like total dad jokes today. Take care, buddy. Bye-bye.
Stretch marks are very frustrating for many people. A lot of people get them at puberty when their hormones change and they go through growth spurts. Other people get them during pregnancy, of course, for obvious reasons. And, you know, there are other conditions that cause stretch marks.
So what are stretch marks anyways? A stretch mark is actually a break in the dermis, which is the deeper level of the skin. And this can happen at any point in life when we have a rapid progression or growth. So puberty, rapid weight gain, pregnancies. And what happens is those collagen and elastic fibers that support the skin, they actually rupture, and it's impossible to get rid of.
It's impossible to make the skin look the way it did before the stretch marks developed. But there are lasers we have that will reduce redness in stretch marks to mature them faster and make them less thin and shiny when they heal. So that's the vascular laser.
You know what my favorite stretch marks are? The ones that are below the belly button, but above the pubic area. Why? Because I can make them disappear.
And we can also do the Fraxel or a resurfacing laser to blend in the appearance of the stretch mark areas with the normal skin. Because as you know, stretch marks that are mature often look shinier and more indented. And so this way we can make the skin look more even and smooth. But like I said, nothing will restore the skin to pre-stretch mark appearance that we know of yet.
So I know I've been trying to give you guys tips in all the episodes for home remedies, but unfortunately for stretch marks, they categorically don't work. Coconut oil, vitamin E, cocoa butter, all these massages, they're a waste of time. I mean, really, unless you can convince your partner to give you a daily massage, in which case I'm all for it. A little white lie never hurt nobody, and I'll write your prescription for it too.